I wanted to take a moment and I wanted to talk about the denture journey. The denture journey is not a uniform journey. It is not a one size fits all thing. It would be wonderful if it was just a straight line from start to finish for every single person. But for some people, it is a straight line, pretty straightforward, uncomplicated, and it's just you start here and you go all the way through. You go with the extractions and you adjust to your temporary dentures or not having dentures, and then when you get your next set of dentures months down the road, you adjust to them easily. You adjust to eating. Everything is just a straight line. And then for other people, it is not a straight line. It's one of those maze books with the most complicated mazes in it, where it's just these twists and turns. And even though it says start here and end here, you cannot figure out where in the world the middle part is. Like, how are you going to get through it? And it's just really confusing. Or it's just a weird bingo game where, you just have all the different things, struggles with this, succeeds at this, does this is simple, this is hard, and you're just kind of filling it in as you go, and you don't know which little chip is gonna go where, and which word is gonna pop up, or which thing is gonna be the thing that you put that little chip on. It is not a one size fits all, and it would be wonderful if it was, but it's not. And it would be wonderful if dentists acknowledge this journey for what it is, which is having prosthetic teeth. And if they would treat it like that, if they would educate their patients, but so many do not. It is not a cut and dry, uniform, one size fits all, this is what you need to expect journey. And a lot of dentists don't tell their patients what to expect because they don't have dentures. So they don't know what to expect. They know what their patients tell them. And if the majority of their patients are struggling with their dentures, that's what they're going to tell you. Also, unfortunately, a lot of dentists really do try to push the implant aspect of prosthetics on people. So they do try to push that having implant supported dentures on their patients because that's where they make their money. And not all dentists are like that. My dentist isn't like that. My dentist has never pushed for me to have implants. It's never come up, not 18 years ago, not now. It has not come up. And even though I have gums that could support implants, it was not something that I ever brought up. It's not something that I am interested in. And it's not something that my dentists ever pushed at me. But that's not the case for everyone else. This journey is so personal. Each person, you could put 10 people who have had their teeth extracted and who have prosthetic teeth in the room, and out of those 10 people, you are going to get 10 very different experiences because it just depends on each person, on their mouths, on their dentist, on their dentures, on how they heal, on what they do while they're healing. Some people don't follow the instructions that their dentists give them and they struggle more. Others follow them to the letter and still struggle. It's not a one size fits all, and we don't get the explanation. We don't get the physical therapy that comes with having prosthetics. If someone has a limb amputated and they get a prosthetic limb, they get physical therapy. They're shown how to use their prosthetic limb, given exercises to do and goals to set and things to do to help them learn their new normal with their prosthetic limb. That is not something that happens for the majority of people who have prosthetic teeth. Their dentists don't say, okay, do this and do this and do this, and this is how you do it. So there are people like me who make videos and we talk about this. When you are new on this journey, first and foremost, when you get your dentures, you are not going to just pop them in and go. Some people do. There are people who absolutely put them in, do not struggle. They're the straight line people. But for a lot of people, they're that weird maze person. And it's not just put them in and go. You don't just put them in, sit down and eat a really great meal that involves a lot of chewing. You have to learn so many things when you first get prosthetic teeth. Now, if you get your teeth extracted and you get temporary, immediate, or healing dentures, they're all the same thing. just different words for the same thing. They're those dentures you get as soon as your teeth are extracted. They act as a bandage, and they help to compress that tissue so that it's not swollen, it's not as tender. Some people say, well, that sounds like it would be very painful. I got immediate dentures, and honestly, I can't imagine going through the healing process without my immediate dentures. I don't know what it's like to not have them. I have never eaten without my dentures in. I have not ever had a day where I didn't have teeth. I had my teeth extracted, and then I got immediate dentures, and I've never been without. And I can't imagine it doing it any other way. That doesn't mean it's the right way. It's just the way that I went through it. So if you get those healing dentures, you have to manipulate them without adhesive while your gums are healing, while they are shrinking, because they're swollen when you first get your teeth extracted, and they shrink as time goes on. And then those dentures are kind of moving around because they go in when your gums are swollen, and then they're a little bit too big and they have to be adjusted, and you have to get a soft reline. There's a lot of things that go into it, and you don't know how to keep them in while you're trying to eat, because it's not something we're obviously born knowing, how to hold prosthetic teeth in with our tongue, and our muscles aren't used to holding them in. So it's a lot of work. It's a lot of work. And for a lot of people, they want to take their dentures out and eat without them because it's easier to just not mess with it. It is really, really important. And when you're going through that phase, when you can't use adhesive, you're still going through the shrinking phase and all of that, don't take them out all of the time when you are eating, because if the more you take them out, the more you're taking them out because they're uncomfortable, the less you're going to adjust to them. That's just a fact. If they are causing you pain because they are digging in to spots, obviously go back to your dentist. That is not normal. You should not be dealing with intense pain as your dentures are digging into spots here and here, or digging on the other side in the tongue, or flipping all the way, digging all the way up in here. Those things are not normal. You'll have to talk to your dentist about that and get those issues taken care of. That is not normal. If it's causing extreme pain and sores, absolutely take them out until you can get all of that fixed. But if they are not causing sores, if they are not causing extreme pain by digging, it's really important to push through those moments. If you go months without dentures because for whatever reason you couldn't afford a healing set, you opted to go without a healing set, your insurance didn't cover it. There's a lot of different reasons why people don't get healing dentures. If you don't get healing dentures and you go 6, 9, 12 months without dentures, when you get your dentures, what's going to happen is it is going to be a little bit more work than you may be anticipating, because you've adjusted for how many months that you went without dentures to eating, talking, smiling, doing all those things. You kind of you adjusted to life without your prosthetic teeth. And now you have prosthetic teeth, and you have to learn all of the things all over again. And you have to relearn how to eat, how to talk, how to form words, how to do things, how to smile, adjust to the new person in the mirror. Because you adjusted to the person without teeth. Now you have to adjust to the person with teeth. And that's a lot. You will see a stranger when you look at the mirror with healing dentures, and if you get dentures immediately, if you get dentures months down the road, either way, you're going to have an adjustment period. And my dentist, so when I got my dentures 4 years ago, I replaced 14-year-old dentures, got these. My dentist told me it is going to take 9 to 12 months for you to fully adjust to these new dentures. Do not take them out. Do not put your old dentures back in. You need to push through the adjustment period. And she wasn't kidding. I did not like the person I saw in the mirror. Did not like the person I saw in photos. I struggled for quite some time with eating and chewing because my other dentures fit a certain way. The teeth were a certain size. These are much bigger teeth. And there were a lot of things I had to adjust to. And it was frustrating. But her words stayed in my head. And I did not take them out to eat. I did not switch to my other dentures. I did have a small period of time where I couldn't wear those dentures for a couple of hours. Well, I would wear them for most of the day, but I would have to take them out because they were causing sores, really intense sores. Up here, this side was just like jamming up here. And then I had some sores over here. But after a couple of weeks, my dentist got everything together and I was able to wear them all the time again. But there were periods of time when I just had to take them out. I would eat with them in, but then I would take them out because they were just causing me a lot of pain. But you're going to have an adjustment period. That's going to happen. It is just an inevitable part. You're used to you with how your teeth were when they were failing. If you do not get healing dentures, you are used to that person that you have been seeing in the mirror for however many months. It's going to be an adjustment period. There are going to be times when you just get really frustrated on this journey. You can't give up, even when you want to give up, because when but be kind, patient, and understanding with yourself. There's going to be days when you just cannot wear your dentures. And if that happens, that's okay. Take them out, give yourself a break, try again tomorrow. There's no judgment. This is a judgment-free zone. Don't pass judgment on yourself. If today is a hard day, it's okay. It was a hard day. Try again tomorrow. Set goals for yourself. I'm going to try to eat this. I'm going to try to eat this. I'm going to try to say these words. Read tongue twisters and children's books. Sing. Set aside a chunk of time every day to practice speaking and forming words. Set aside time every day to practice eating. We don't get physical therapy like someone with a prosthetic limb. We don't get that. We have to give it to ourselves. But it's so important to be kind and patient and understanding to ourselves. This is new for us. We don't know what the heck we're doing. We don't have anybody showing us how to do it, what to do. There's nothing. You must treat this journey for what it is. You have prosthetic teeth. You have to treat it the same way you would if you had a limb amputated and you had a prosthetic limb. That is very, very important. So hopefully this video helps anyone who is struggling on this journey, who is just frustrated because it's not a straight line, and they're struggling and they are frustrated because they want it to be a straight line, and it's not a straight line. It's one of those really complicated mazes. It's a really twisted game of bingo, and they just don't know where they're going with it. If that is you, you are doing a great job. You are doing a great job because you found this video, you were looking for help, and you are looking for positive. And I hope you found that in this. It is going to be okay. It might not be okay today. It might not be okay tomorrow, but that doesn't mean that's always going to be not okay. It will get better and you're going to be fine. And it might not seem like you're going to be fine, and it might take a while to be fine. It might take a lot of adjustments and a lot of soft relines and then a hard reline, or you might have to use it, do it yourself, home reline like Cushion Grip or Denture Fit, and you may be struggling. But at some point down the road, hopefully it will be okay. I can't make promises that everybody is going to be okay, because there's a lot of different factors, but I'm hoping for everybody that there will be the day when you are okay. And I know that there is a possibility that it might not be, but hang in there. I try not to sugarcoat things. I try not to give false promises, but hang in there. Today might be rough. Tomorrow will be better. Tomorrow might be rough, but the next day might be better. Just keep pushing it, one day at a time, one day at a time, one day at a time. I'm going to go ahead and let you go because this has ended up being a little bit longer than I wanted it to be, but I just really needed to put this out there and let people know that they're not alone. There are people going through exactly what you're going through, and you're not alone, and you're going to be okay. And I'm going to talk to you later, and you have a great one. Bye.